we have already established molecule, that is ramipril, is lisinopril or statins, but they have not been shown to increase the renal outcome, although they decrease the proteinuria. SGLT2, yes, it is. Now there is another molecule which we are going to discuss now, is the finerenone. So what is finerenone? Finerenone is the key drug which prevents MR activation through antagonizing aldosterone and cortisol. Now, is anything more is available than finerenone at the present moment? Yes, we are actually using spironolactone for more than few decades, which usually came up with patient with gross ascites and chronic liver disease. And then we thought that this drug may be good for patient with heart failure with preserved ejection fraction. And also we found that this drug is good for patient with uncontrolled hypertension, where hyperaldosteronism has been suspected strongly. Because of its side effects, as it penetrates the CNS, we thought that eplerenone may be a better choice. And in this today's scenario, we are using all these two in patient with this condition, and particularly heart failure with reduced ejection fraction. If we know very clearly their mechanism of action, that is not important. The more important is the pharmacokinetic therapies. So they have a little bit prolonged half-life, and which is a matter of concern, that once the hyperkalemia develops, it takes time to disappear despite whatever you give, and then the patient needs to be in the hospital for a long time. So presumably, if you are giving a bulky non-steroidal finerenone, which has very high selectivity, no CNS penetration, and a short half-life, with a tissue distribution of kidney to other tissues, heart is 1:1, probably you are doing good for the kidney and the heart both. And with this thing in mind, a group of investigators has come up with more than 5,000 patients, and these are the Fidelio Figueroa group of studies. And rather than discussing the studies in detail, we come to what they have understood from this large trial, that patient with diabetes across all CKD severity treated with maximum doses of RAS inhibitor up to a tolerated level, and 40% of this patient has albuminic CKD with preserved kidney function. 99% patient have already been on a higher dose of ramipril, lisinopril or statin, and the blood pressure was well controlled. There are some patients who actually don't history of heart failure at all. So they are so-called silent sufferer. And when this patient has been given this treatment, what we found, the intention to treat group has a lower incidence of sudden cardiac death, which is very impressive, and all-cause mortality also is significantly reduced.